everyone. Hi, my name is Lindsay White. I am the Director of Programs and Partnerships here at the Leukemia Research Foundation. Together with Amanda Goodstadt and our colleagues at Leukemia Research Foundation and Triage Cancer, I would like to thank you for joining us for this webinar today, focused on cancer and finances. I would like to take a moment to thank our supporters who are on the screen I just was sharing. It's AbbVie and BeiGene. We would also like to thank our webinar partner, Patient Empowerment Network. The Leukemia Research Foundation's mission is to cure leukemia by funding innovative research and to support patients and families. The foundation has raised over $90 million in support of its mission since our founding in 1946 and has funded research grants to over 600 new investigators worldwide. Our support programs for leukemia patients and the loved ones include information, resources, education programs, financial assistance, and a directory of other helpful organizations and resources on our website. Just a few quick housekeeping items for our program. All participants will be muted throughout the program. If you already submitted a question at registration, please know that we have your question. We received several questions and we will do our best to cover as many as possible. You can also type a question into the Q&A box at the bottom of your screen. After today's program, you will be sent a brief evaluation through email. Please just take a moment to complete the evaluation so we can improve our future programs. Also, this program will be recorded and sent to participants and posted on our website for future reference. We're grateful to have Amanda Goodstadt from Triage Cancer with us today to take us through things to consider as you navigate cancer treatment. Amanda is an attorney and previously served as Vice President and Assistant General Counsel for a division of News Corp. Prior to joining Triage Cancer, Amanda spent 12 years counseling seniors and caregivers about Medicare and related benefits through the Westchester, New York library system. She most recently served as a program coordinator for the WLS Senior Benefits Individual Counseling Program. In addition, Amanda has been a caregiver coach at Ken Hamilton Caregiver Center at Northern Westchester Hospital. She has a lengthy history of volunteer work with nonprofits, including service on multiple boards of directors in her community. Amanda, thank you so much for joining us. I'm going to turn it over to you now.
Thank you so much, Lindsay. Just checking, can you see the slide okay? Great. It's very nice to be here, and I thank you all for joining us today to talk a little bit about cancer and finances. For any of you who are not familiar with Triage Cancer, we are a national nonprofit, and we provide free education on legal and practical issues that can impact people who've been diagnosed with cancer and their caregivers. So today, Lindsay asked if I would talk about financial issues related to a cancer diagnosis. Just like cancer has physical side effects and emotional side effects, it has financial side effects. And unfortunately, just like the other kinds, the financial side effects are typically going to be negative. It's possible that they're caused entirely by the diagnosis, or it's possible that certain financial issues already existed and are exacerbated by your diagnosis. And I'm going to refer to these negative financial consequences as financial toxicity. There are certainly any number of factors that are going to impact someone's overall financial health. But the one factor that we at Triage Cancer feel is the most significant contributor, and the factor that everybody who has a diagnosis is going to have in common, is health insurance status. Whether someone has insurance, if they do, whether that insurance is adequate, and if it's adequate, whether the person knows how to use their insurance effectively to try and minimize costs. We have really found that the primary way to mitigate financial toxicity is making sure that you're choosing and using your health insurance the best you can. So that's why I'm going to focus on this as the main topic today. Having said that, it is not, of course, the only thing that's going to influence financial toxicity. someone's place with employment, whether they're working through treatment, whether they're not, whether they're able to access time off, and if that time off is paid, whether someone can access disability insurance. All of those types of employment-related concerns are going to impact financial health, as are other life changes, right? Things that everyone experiences, like marriages, divorces, having children grow up, and whether or not you're still financially supporting them. So I'm not ignoring all of these other factors, but I do want to focus on the one that is common to everybody who's on today's program. So if we know health insurance status is the most significant contributor to financial toxicity, it should be pretty easy to figure out how to combat it, right? Unfortunately, not right, because one of the challenges we have when we talk about health insurance in the United States is it's really complicated. And a lot of Americans don't understand how it works, and they don't understand how to choose a plan that works best for them. In this survey, 96% of the people who were asked couldn't define these 4 basic terms that are used in health to discuss what that insurance is going to cost. So if you've wondered about these terms or other terms you've seen in your policy, or you've been confused by things that you've read, you're definitely not alone. Although I do hope that after today, you're going to feel at least a little bit more confident about your ability to review and select insurance. And the importance of doing that, I really can't overstate, because when I talk at the end of today about financial assistance resources, I think what you're going to see is, even though there are a lot of options out there and a lot of programs out there, there are still limited resources relative to the large number of people who need help. So it's our hope that by maximizing the use of your health insurance, you're going to reduce the need to look for financial assistance later on. A quick overview of what I want to try and get through today. It's a lot in a pretty short amount of time, but I'm going to start out with some basic concepts that are important for understanding health insurance. I'll move into some strategies for managing medical bills, including using appeals. And then I'm going to talk briefly about financial assistance and say a few words about accessing new treatments via clinical trials primarily. So no matter where you're getting your health insurance, whether you have Medicare, whether you get it through an employer-sponsored plan, whether it's on the marketplace, you have to know certain basics. And we're going to start out with those terms that most Americans weren't comfortable defining. These terms all have to do with what your insurance costs. It would be way easier if insurance was like a product you picked up when you went to the grocery store and there was one sticker on it with one price. But unfortunately, that's not how this works. So the first term to understand is premium. That is the cost you are paying each month just to have the insurance. It is a fixed dollar amount, and you're paying it whether you are going to the doctor all the time or whether you have a year where you don't see a doctor once. Then there are costs when you actually start using the insurance. The first of those is your deductible, a fixed dollar amount that you're paying out of your own pocket before your insurance kicks in and starts to share in costs. Deductible amounts vary plan to plan. They can be very high, but they can also be very low or even zero, meaning a plan starts to share in costs on day one. Then there's a cost each time you actually get care, each time you go to a doctor or get a lab test or fill a prescription. That cost can be expressed in one of 2 ways, either as a fixed dollar amount, in which case it's called a copayment, or as a percentage of total cost, in which case it's called a coinsurance or a cost share. And then the final term on this slide related to cost is out-of-pocket maximum, a fixed dollar amount that represents the most someone is going to pay out of their own pocket for covered medical expenses during the year. Once someone reaches their out-of-pocket maximum, their plan takes over and pays 100% of covered expenses for the rest of that year. Out-of-pocket maximum amounts are going to vary by plan, but also what the out-of-pocket maximum represents can vary by plan. So as an example, if you have a marketplace policy, Your out-of-pocket maximum is the sum of everything you pay for your deductible and all your copays and all your coinsurance amounts. So a super quick, super simple example of how this works. Here's Dan. He has an individual plan he bought on his state's marketplace. His plan has a $2,000 deductible. It's an 80-20 coinsurance. The plan pays 80% of expenses. Dan pays 20%. And there's an $8,000 out-of-pocket maximum. He ends up in the hospital at the beginning of the year with this really large bill. What does he have to do? What does he have to pay? Well, he first pays his deductible of $2,000. Excuse me, that leaves him with a balance of $100,000 on this bill. His coinsurance is only 20% of that, only 20%, huge amount of money, $20,000. But he has an out-of-pocket maximum of $8,000. The $2,000 deductible counted towards getting to that out-of-pocket maximum, leaving a balance of $6,000. And so out of the remaining $20,000, Dan has to pay $6,000. His coinsurance plus his deductible have totaled out at $8,000, and now his plan takes over and pays the rest of the expenses for the plan year. If you happen to want to see that example again or share it with someone, we have a number of animated videos on our website, and this is in the one about health insurance basics. Now, of course, nothing is all that simple with health insurance, so there are nuances to out-of-pocket maximums. The first is, if you have a health insurance plan that provides out-of-network coverage, you may have a separate out-of-pocket maximum for in-network services than you do for out-of-network services. My Dan example was of someone who bought individual health insurance, but if you have a family plan, each of the covered individuals may have an out-of-pocket maximum as well as the family as a unit. I mentioned for the marketplace, by definition, all marketplace plans use the same definition for out-of-pocket maximum. They count everything you've paid towards your deductible and all your copayments and all your coinsurance amounts for both medical care and prescription drugs. But if you don't have a marketplace plan, the plan may not calculate it looking at all of those elements. For an employer-sponsored plan, as an example, they may not count your deductible. You may have to satisfy your deductible and then start at $1 and add up copayment and coinsurance amounts. You might not even be able to count copayment amounts. It might be a plan that just looks at what you've paid in terms of coinsurances. And there are a lot of plans that will have a separate out-of-pocket maximum for medical care than they do for prescription drugs. So you have to know to look out for all of these things. I mentioned the concept of in-network and out-of-network coverage. I just want to make sure we're all on the same page about that. Most health insurance policies in this country have networks of providers, meaning the insurance company goes out and they contract with different types of providers, with different doctors and hospitals and lab groups and pharmacies, and they make those providers part of their network. They agree with the provider that if someone with that insurance plan goes and sees that provider, then the person is going to be charged the contracted amount or an allowed amount. Now, what happens if you want to see a provider who isn't in that plan's network? One of two things. Some plans, like if you have an HMO, don't provide any out-of-network coverage. And if you want to see an out-of-network provider, you're going to be responsible for 100% of the cost. Other plans, though, like for example, PPOs, have out-of-network coverage. So you can go and see that provider, but it's probably going to cost you more than if you stayed with the provider who is in network. Another important concept that people sometimes find challenging to grasp is the concept of prior authorization. This is where an insurance company requires special approval before they're going to authorize certain care. The concept exists both for medical care and for prescription drugs. Now, first off, this isn't always called prior authorization, so be on the lookout if you see words like pre-certification, advance approval, prior approval. All of these things are referring to this concept. And unfortunately, most insurance companies aren't going to hand the patients a comprehensive list of all the things that they might need that will require prior authorization. Once upon a time, like when this concept first started out, it was reserved for really just the most expensive items. Prior authorization would be required before you could be admitted to the hospital or before you had a surgery. But nowadays, first of all, it's going to vary plan to plan. But second of all, it is possible that things you might think of as being fairly routine still require it. A lot of doctors' offices have started helping their patients through this process, right? Especially really big medical groups. They may have entire offices of people where this is what they do all day. They go to the insurance companies and they get prior authorizations completed. But understand, pardon me, ultimately, it is the patient's responsibility to make sure this happens. If your doctor's office is helping, that's great, but stay on top of the situation, because if they don't end up getting the prior authorization and you are able to get the underlying care, you're going to still be on the hook for the cost. Another challenge we've seen people have is sometimes they'll get prior authorization and then they get the underlying care and not all of that care is covered. So at this point, really what I want to leave you with is the idea that you can appeal in those situations, and you can also appeal the denial of a prior authorization. And I'm going to talk at length about appeals in a few minutes. Last set of terms that I want to just make sure I've reviewed are terms related to prescription drugs. The first of those is formulary. That's just the list of drugs that are covered by your insurance plan. Formularies are broken down into different levels or payment tiers, depending on how much of the cost of a drug the insurer is going to cover. If you want to fill a prescription for a drug that's not on your plan's formulary, you're responsible for 100% of the cost, and whatever you pay is not going to count towards any deductible or out-of-pocket maximum. In terms of the number of tiers on a plan, that can vary. But generally speaking, the lower tiers are where you're going to find your least expensive drugs like generics and your least expensive copayments, sometimes even no copayment. Higher tiers are where you're going to start seeing brand name drugs and then specialty tier drugs, newly approved drugs, a lot of the drugs people want to get when it comes to cancer care. And you're less likely to see a copayment and much more likely to see a coinsurance amount so that you are paying a percentage of the total cost of the drug. Generally speaking, if a drug isn't on your plan's formulary, it isn't covered. But you or your doctor can do what's called request an exception to add a drug to the formulary, or to cover the brand name version of a drug if the generic version is the only one on the formulary, or to ask that a drug that's on a higher tier or a more expensive tier be covered at a lower tier's cost. You can ask for exceptions, as an example, if you're allergic to the version of the drug that's already covered, or if you have had a serious side effect from the drug that's already covered that you wouldn't have if you got the drug that you're looking for access to. If asking for an exception doesn't work, you can make an appeal if you're denied. The other thing, though, that I really want to emphasize about prescription drugs is sometimes people assume, like, okay, the drug's on the formulary, I'm safe, there's nothing really to worry about. The problem with that is insurance plans can impose restrictions on accessing a drug even when it's on their formulary. So common types of restrictions are requiring prior authorizations, like we just talked about, quantity limits, and step therapy. Step therapy is when the insurance plan will ask you to demonstrate, or to certify rather, that you've tried a less expensive drug or course of treatment for whatever it is you're trying to handle by taking this drug, and the less expensive treatment didn't work, and so thus you need the more expensive drug. Okay, so that was sort of my introduction to concepts and terms that are important. And those terms are used in all types of health insurance. But I want to step back for a minute and just remind people where it is that you can get health insurance, because we find sometimes people know how they currently get their health insurance, but they don't realize there might be another option. So there are 3 places Americans can access health insurance. From the top of the pyramid to the bottom, the top is you can access it privately by buying a policy directly from an insurance company. This is actually the level of the pyramid where the marketplace is. The marketplace is government regulated, but if you buy a marketplace plan, you are buying a plan directly from a private insurance company. Second place Americans get health insurance is through the government, including programs like Medicare, Medicaid, TRICARE, the VA system, certain other state or local plans. And then the final place where around half of Americans get their health insurance is through an employer. Might be their own, might be their spouse's, might be a parent's, might be a former employer, like if you're on COBRA or you have retiree coverage. Again, I'm unable in the limited time we have together to talk in detail about each of these options, but I will highlight that we have a lot of resources that are available online about all of these topics. Once someone has identified and narrowed down their plan options, they have to know how to compare those options. And I want to walk through an exercise about comparing the cost of health insurance plans. I use 3 marketplace plans in my example, but the technique that I'm using or the work that I'm doing, it's just as applicable if you're comparing 2 employer-sponsored options, or you're going to compare an employer-sponsored option to a marketplace option. For those of you with Medicare, with a little bit of tweaking, it can also be used to compare Medicare Advantage plans. So here I have 3 health insurance plans available to our fictional person. Each of these plans has a different premium, deductible, and out-of-pocket maximum. And in our example, we have a person who has a diagnosis of cancer. We're going to assume that they need a lot of healthcare this year. They're in active treatment, and we're going to assume that they're going to reach their plan's out-of-pocket maximum during the year. And our goal is to figure out prospectively which of these plans will be the least expensive for them to purchase. I don't know if anybody is sort of guessing just based on looking at the chart and doing nothing else, but I will kind of jump ahead and say the only way to really compare these plans is to do some math. Our goal, any of us as consumers, is to choose a plan with the lowest total cost for the year. And in order to do that, you have to do math, which I hate to do. I'll just be honest. The math we have to do is we have to multiply each plan's premium amount by 12, because that's a fixed cost for the entire year. And then we have to add to that amount the plan's out-of-pocket maximum. In the case of the marketplace, deductibles count towards getting you to your out-of-pocket maximum, so we don't have to add that in separately. When we do this math, something interesting happens. We take our bronze plan at the top, which has the lowest monthly premium of these 3, and seems like it might be kind of the bargain choice, or the choice we would go with if we're really concerned about money. We look and we see a lower amount. But that plan totals out at $10,400. Our silver plan, slightly higher premium, totals out at $9,300. And our platinum plan, that gives you a little sticker shock because it's twice the price of the bronze plan in terms of that monthly premium, totals out at $6,800. Just by doing this one math exercise, this person is saving $3,600. In all the years that I've done health insurance counseling, I find that people tend to focus primarily on premiums. It's tempting to do that. We know it's a fixed cost. We know a lot of people budget on a monthly basis, but premiums only tell you a portion of the story when it comes to cost of health insurance. So it's very, very important to go further and to do this math exercise with whatever kind of plan you're looking at. Having said that, comparing costs is really just the first step in comparing health insurance plans. It's an important component, but it's not the only component that people want to look at. So I consider it one of three key considerations. The second of those key considerations are networks. Are the providers that you've been seeing or that you think you want to see in network for the plans that you're considering? Are the facilities where you want to be treated in network for that plan? And if they aren't, are you considering a plan that has out-of-network coverage? And if so, what will the price be on getting the care at those out-of-network facilities? And then the third key consideration people need to keep in mind is prescription drug coverage. Are the drugs you need covered on a plan's formulary at a price you can afford? Also, is there a separate out-of-pocket maximum to be thinking about when it comes to those drugs? And is the insurance company going to place any restrictions on getting those drugs? Choosing the right plan is so important to your finances that we have created a number of resources just around this concept. We have an animated video which contains the example I just gave you on picking health insurance plans. We have this health insurance plan comparison worksheet that can walk you through the math. And then we have a special health insurance plan comparison worksheet for people with Medicare where they can compare Advantage plan costs. They can compare the Advantage plan to an original Medicare situation, and they can also compare Medigap pricing. There's a lot of work, right? It takes some time, and unfortunately, this is not a one and done sort of exercise. It is really important to review your health insurance coverage at least once each year around the time of your plan's open enrollment. Your circumstances can change. Maybe you get a new job, or maybe you become eligible for disability insurance. Your health could change. Maybe you go from a period of time where you didn't need very much care back to needing a lot of care. But even if your circumstances are stable, even if your health isn't changing, even if you keep the same insurance plan that you had last year, the costs and the coverage of that plan can change each year. So it's very, very important to work this into your yearly to-do list of tasks. Now, the reality is, even if you have adequate health insurance and you're doing your very best to use it effectively, it's unlikely that it's going to completely eliminate all your bills. People I talk to often have a lot of anxiety around their bills. So I want to make a couple of suggestions, share a few things that we often talk to people about. And there are strategies you can use whether you're still in active treatment or whether you are in a period of surveillance or getting follow-up care. Once you get any care, you're probably going to get a lot of correspondence. A lot of correspondence from the insurance company. The piece of mail from your insurance company that is probably most important is your explanation of benefits, or EOB. It is a statement from the insurance company that gives you an idea of how much money you are supposed to pay out of pocket for a particular service. EOBs can be a little bit challenging. This is an example of one that we created, one that would have a lot of information on it. The telltale sign of an EOB is somewhere it's going to say this is not a bill. It's not a bill. It's just the statement from the insurance company. Usually there's information about who carries the insurance and who the patient was. There's typically a summary saying this is how much a provider billed us for, this is how much we are paying, and this is how much we think you, the patient, owe. And then there's a lot of breakdown of those amounts. There'll usually be a date of service, a code or codes related to the services you got, and additional information about the allowed amount, anything that was applied for your deductible, what constitutes a copayment or a coinsurance. And then with a really good EOB, somewhere on it, it will tell you, as of processing this claim, here's where you are with respect to meeting your deductible and your out-of-pocket maximum. Besides your insurance company, though, the other party that's going to send you mail after you get medical services is your provider. And of course, what they're sending in the mail is a bill. Unfortunately, it doesn't always happen in this order, and it doesn't always happen in a timely fashion. As you know, it can be way past active treatment, and you're still getting bills for services that were provided months ago. We really encourage people to wait for explanations of benefits before you pay any bills. If you just automatically pay a bill because you assume that whatever the provider is telling you is accurate, you can sometimes end up paying the provider more than you actually owe. And then you wind up with another administrative headache of having to go to that provider and ask them to refund that money to you. So our suggestion is wait for that EOB and match each of your EOBs to the corresponding bills that they're for. Keep track of all of this and don't just sort of ignore your provider. If they're sending you bills, you can call and you can say, look, I haven't gotten an EOB yet. Can you make a mark in your file? Can you indicate that, I'm not just planning not to pay, but I'm not going to pay this until I fully understand what my insurance says they paid and what I'm responsible for. Another thing to keep in mind, if the provider who's sending you a bill is a hospital, in this country, all not-for-profit hospitals are required to have what are called charity care policies. They have to provide financial assistance to patients in exchange for the tax-exempt status they have from the IRS. Unfortunately, even though so many hospitals have these policies, a lot of them don't do a great job of publicizing the policies or proactively reaching out to patients who might benefit from them. Each of the hospitals has its own criteria for who qualifies for help, but it's not the case that these are policies only for people who are uninsured. If you need help finding your hospital's charity care policy, we partner with a wonderful nonprofit called $4. Their whole mission is getting people access to charity care programs. You can apply online and you submit any bills to them that you feel you can't afford from the hospital, and they can help you figure out if your hospital has a policy, whether you're eligible for that policy, and they'll even help you with applications. We really encourage you to review all of your bills for accuracy and review all of your EOBs carefully. Medical billing is a human process and people do make mistakes. Don't be afraid to call and ask for clarification on things that you don't understand. There are ways to look up the codes that you might see on these documents. This is also a great area if you have friends or family members who've been asking how they can support you. You might hand them a stack of paperwork and say, hey, can you go through these? Can you match up which of these EOBs goes with which of these bills? Because I'm having trouble focusing on this in the midst of everything else I'm doing. There are also professional bill review organizations out there. Those are organizations that are going to charge you for doing this. But if you really feel like you can't handle it and you don't have someone in your life who can help you, this is also a possibility. It is really important to dispute bills if there are problems. And if you believe that something you were provided with should have been covered and it wasn't, know that you have the right to appeal that decision. You do not have to take no as the answer from your insurance company if they issue a coverage denial. Sometimes that's called an adverse benefit determination. Claims get denied all the time. There is one study that one of my colleagues found showing more than 200 million claims are denied every day. It is a staggering number. Even though there are other studies that show at various points, the appeals process has resulted in a finding in favor of the patient somewhere between 40 and 60% of the time. So a lot of the time, insurance companies are getting it wrong when they give a denial, but they sort of count on the fact that most people don't do anything about that. The first step in the appeals process is figuring out what kind of insurance plan you have. I don't mean what company is issuing your insurance. I mean how you get it. You get it through an employer, through Medicare, through any of these other means. And that is because the appeals process and the rules and the timeline differs based on how the insurance is provided. I don't have time today to walk through all the different types of insurance and what the process would be for each, but I do want to highlight that if you have a marketplace plan or an employer-sponsored plan, you generally have 2 opportunities to appeal a coverage denial. The first of those opportunities is what's called an internal appeal. Basically, you go back to the insurance company that said no, and you say, hey, please reconsider this. The second opportunity is an external appeal. Sometimes it's called an independent medical review. And that's where you ask an independent entity to look at the situation, to look at everything the insurance company did and figure out whether they think the insurance company was right or wrong. Once you understand the steps of your appeals process for your plan, you want to figure out why it is that the insurance company said no. In the letter they sent you, they should have given an explanation for that. There are a lot of different reasons plans can issue denials. Sometimes they're for things that I sort of call administrative reasons, like there was the wrong billing code, there was a factual mistake, there was trouble coordinating among different insurance plans if you have multiple insurances and they billed the wrong one first, things like that. In the cancer context, the denials that we hear about more often are things like this treatment is not medically necessary, or this treatment is experimental or investigational in nature, or we see a denial of coverage for the off-label use of a drug, meaning a drug was prescribed in a situation that it was not initially approved for. If you're looking at a denial like those for medical reasons, it is really critical to get a letter of support from your healthcare provider that describes the medical reasons that you need the care you're trying to get. Really getting your doctor or your other healthcare provider involved to help with appeals can be a crucial step to success. Your healthcare provider is the one who can help you submit things like treatment notes and test results. They can point you to, they can either supply or point you to so that you can supply current medical literature, peer-reviewed articles, studies, all of which document the effectiveness of whatever the medical procedure or the drug is that you are trying to access. You can also, along with all the medical information, submit a personal narrative to the insurance company or to the external review organization that describes why it is you need whatever service it is that was denied. So none of this sounds like it can be done easily, right? Unfortunately, the appeals process is something else that someone who has a lot of other stuff going on already is being asked to do. There are a bunch of hurdles with this, one of which is being able to stay organized. We created an appeals tracking form you can download from our website to help you track dates and deadlines and important conversations you've had. I know there are some people who like the colorful Post-it note method of keeping track of things. I know for me personally, I will always inevitably lose the one Post-it note that I really need at any given time. I personally like to tell people to keep, if you're keeping loose notes, rather than loose, keep like a small spiral notebook. And that way the pages don't go anywhere and you can just flip back through and make sure every time you talk to someone, you're keeping track of the date and the name and the number that you called. Again, this is a good opportunity if you have family members or friends who are willing to help you out. This is something that could be delegated. Another hurdle we find with appeals is peer review. That is the process during an internal review where an insurance company has its own healthcare professional talk with your provider. So maybe the health insurance company doctor wants to talk to your oncologist about whether a certain procedure is medically necessary. 2 big challenges we see with this. One is a lot of times the insurance company doctor doesn't have the same specialty or specialized knowledge that your provider has. know that your provider can ask to talk to someone else who has that knowledge. So instead of talking to maybe the staff doctor at the insurance company who's a retired pediatrician, maybe they can talk to a radiation oncologist instead. The other challenge is don't confuse peer review with external reviews. A peer review is not an external review. So if you go through peer review with your internal review, you are still entitled to an external review. And then the final hurdle that I want to just highlight again is knowing about appeals in the first place. Insurance companies really do count on the fact that you're not going to do anything if they say no. In this one, this is a study from, I think it's from 2021. And that white sliver on that pie chart represents the 0.1% of, in this case, around 48 million appeals that were denied that actually someone appealed, even to the first step. So when we talk about access to care, or we talk about trying to minimize the negative financial impact of a diagnosis, using the appeal system is a hugely underutilized tool for doing both of those things. Just one final word on the medical bills. If you do find you're in a situation, right, where you do actually owe money to your provider and you are struggling, try negotiating with them and try doing it sooner rather than later so the bills don't get turned over to collections. You can ask for more time to make a payment. You can see if they'll negotiate a payment plan. Maybe they'll take a lower lump sum payment just to close out a claim. And try to get, if they agree to something like that, try to get it in writing. Ask if they'll email you an updated bill to reflect the fact, for example, that they'll write off a certain amount or that you only owe X amount right now, just to make sure that you have that for your records. So even if someone is doing their very best to minimize expenses, there still may not be enough money to pay all of these bills. We do have on our website a tool that we call Cancer Finances. And Cancer Finances has different sections to try and address different topics related to the financial impact of a diagnosis. One of our most popular sections is our financial assistance module. What we tried to do there is we tried to pull together information about many private organizations that provide grants to individuals or to families who've been impacted by a cancer diagnosis. Now, these organizations each have their own mission and their own eligibility criteria. Some of them are focused on a certain geographic area. Some are focused on a specific cancer diagnosis or specifically on cancer versus other medical issues. They really run the gamut. The good news is there's a lot of these organizations. The bad news is there's a lot of these organizations. It's a lot of research. It takes a lot of time to go through them. We try to cut down on some of that for you and make it so you don't have to just Google. You go to our Cancer Finances page, you select financial assistance resources, and then you see within our module, we've subdivided the resources into different types. I'm looking for help with childcare expenses or ground transportation or medical costs or prescription drugs. Try to think creatively. Maybe you really need help. You think of it as, I just need help with ground transportation to treatment, but you don't find an organization that fits your needs in that section. But maybe you're eligible to get assistance with your utilities bills. And so you can shift the money you were going to spend on those over to the transportation. And then, of course, once you click through to any category, you see a list like this of different organizations we've found with brief information. So you can sort of say, yes, that looks possible or probable for me. No, that's not a fit, totally different diagnosis. And the names are links over to the organization's websites. We also have a module that's devoted to managing prescription drug costs. We highlight pharmaceutical assistance programs. Sometimes people are familiar with these because they know that for certain really expensive drugs, there might be copay assistance out there or free drug trials or vouchers. But to be honest, sometimes these programs have additional information. So even if you're not eligible for the copay assistance, they're still worth knowing about. They often can be helpful with billing codes, billing issues, appeals issues, prior authorization issues. Remember, they're in the business of wanting people to access their drugs. And so they hear from patients all over who are having difficulty, and odds are they may have already spoken to someone who's having the same trouble you are, so they might be a good source of information for you. We also have, if you go to this module on our website, we have contact information for the different pharmaceutical assistance programs that are available. Final topic that I want to just touch on is accessing care through clinical trials. A lot of people obviously want to access trials, these research studies that are looking for the latest and greatest in terms of treatments and procedures. And first and foremost, right, you want to talk with your healthcare team and figure out from a medical perspective, which of these, if any, are the right ones for your situation. But once you do that, you're going to probably turn to, well, how am I going to pay for this? So I just want to say a couple of things about that. The Affordable Care Act does require that most private insurance companies provide coverage for the routine costs when you participate in a clinical trial. So what does that mean? Routine costs are the costs you're going to pay even if you weren't part of the trial, like an office visit, blood tests, imaging scans, things you would be getting even if you were just receiving the standard of care treatment for your situation. Insurance companies also can't drop your coverage or refuse your participation in a clinical trial. What insurance companies aren't required to cover are any research costs that are specific to the trial. Like if you needed extra blood tests or extra scans, because that's what the trial sponsors need to judge whether this is, you know, a product or that is, pardon me, that they can't, so sorry. The insurance company is not required to cover anything that is specific to the trial, drug, or procedure, or any additional research that's just for the purpose of research and not for the purpose of treating you. The good news with that is typically that's what a trial sponsor covers. Medicaid also covers the routine costs associated with clinical trials, and there's specific guidance from Medicaid from a couple of years ago, specifically including coverage for out-of-state and out-of-network trials. Although anecdotally, we have spoken with people who sometimes have difficulty getting their state Medicaid plan sponsor and the clinical trial sponsor to get on the same page about that. Medicare, TRICARE, the VA, they all provide coverage for the routine costs of clinical trials in a similar way. Now, just because someone's eligible for a trial doesn't mean that they get into the trial. Some of these trials have limited spaces. Sometimes you've gotten a different treatment that makes it so that this trial is not an option. You can, in these types of cases, ask your doctor to request a special exception in order for you to access the trial. In addition, the Food and Drug Administration also has what's called an expanded access program that allows people access to drugs or medical devices that the FDA has not yet approved. The FDA would rather, if you're accessing those things, that you do that via clinical trial, but they recognize that sometimes that's not possible. So they have this program. It's sometimes called expanded access. It's sometimes called compassionate use. Bear in mind, if you're going through this program, you're looking to access something that has not yet been approved. So the FDA hasn't found it to be safe or effective for the specific use. And it's possible that the drug or the product could cause unexpected and very serious side effects. In order to be eligible to try and use this program, you have to have an immediately life-threatening disease or condition. That means like you're at a stage of the disease where there's a reasonable likelihood that death is going to occur within a matter of months, or in which premature death is likely if you don't have early treatment. There has to be no comparable therapy available. It has to be the case that you can't enroll in a clinical trial. and your doctor has to agree that the potential benefits from getting access are going to justify the potential risks. So this isn't just about, I want to call the FDA and apply. It's not just up to you, it's you, your doctor, an institutional review board, and the drug company. They all have to agree to allow expanded access. If your doctor does not agree with you, you have to find a doctor who would agree with you to apply. And the drug company is not required to offer the product outside of a clinical trial. There's no law that obligates them to do it. They may not have enough of it, so sometimes they will have a lottery. Sometimes they make their decisions on a case-by-case basis. In addition to research costs and the other medical costs of a trial, remember there can be other costs like, where's the trial located? Are you going to have transportation expenses or lodging expenses? Is the length of that trial going to make it so that you are unable to work for a period of time? So these are all things to consider. I will also just highlight, we do have a portal on our website to a clinical trials matching service that we have in partnership with Emerging Med. We think it's a little bit easier to navigate than going to NCI or NIH, but it's the same information. It's not anything additional to what they offer. With that, I will just say any of the resources I mentioned today or that you saw on the slide, I have pulled together into a document that I'm going to send Lindsay and she will share with all of you. But I invite you to visit triagecancer.org. You can see all of our resources there, as well as information about upcoming educational events. And I will also say, if by my talking today, you sort of came up with some questions you have of a personal nature, we do have a free individualized legal and financial navigation program. You can reach out to us. The best way to do it is using the link to our online form. It's English and Spanish. You fill out some brief questions and answers. Then when that's submitted, you'll get a link to schedule a phone call from a staff member. We will probably call you, we'll definitely call you, we'll probably ask you some questions. We'll do our best to explain options you may have and to provide you with accurate information with the goal of empowering you to be able to take next steps. And with that, I will stop sharing my slides and see whether anyone has submitted any questions.
Thank you so much. Can you hear me okay?
I can hear you fine, Lindsay.
Great. Okay. I think that was fantastic information. Thank you so much for sharing all of that. Very helpful tips and definitions, etc. So, and I did not know that Triage Cancer had so many services available and so much information on their website. So thank you. Quick reminder, if you do have a question and you're able to stay with us through to the end, which is just 5 short minutes away, please submit your question on the Q&A. I'm going to go through a couple of questions if we can that were submitted in the registration process. The first one was about disability. I don't think that you mentioned disability. Apologies if I missed it, but could you talk just briefly about disability, that process?
Sure. So disability, I didn't get in just because of the timing. We have a lot of resources specifically about this topic, including a recording of a webinar we did. But the short kind of version of disability insurance is to say there's 3 main places you might have access to it. The first is privately, either if you bought it on your own or if you work for an employer who offers it as a benefit. The second place you can look and see if you have access to disability insurance is your state, but you can only do that if you live in New York, New Jersey, Rhode Island, California, or Hawaii, or Puerto Rico. Those are the only states with short-term state disability programs. And then the big one that most people tend to ask about is Social Security. Social Security has 2 different long-term disability insurance programs. SSI, or supplemental security income, which is for people with low incomes and low resources, and SSDI, which is Social Security Disability Insurance, which is accessing your Social Security retirement benefits before you reach retirement age because you've become unable to work due to your situation. It is I guess I would say in brief, Social Security has a really high standard for disability. You have to have a condition that's lasted or is expected to last at least a year or result in death. And that situation or that medical condition has to be so severe that it causes you to be unable to do the work you've been doing and unable to adjust to any other kind of work. So it's a total disability standard. And it's not so much about a diagnosis as it is about functionally, what are you experiencing day to day from your diagnosis or side effects from treatments that are going to make you unable to work. I don't know if there's a more specific, something more specific they wanted to know, but that's sort of, I would say, a very quick overview. Lindsay, I can't hear you.
Sorry about that. They were just looking for some guidance on where to turn, I think, but they're always welcome to follow up afterward. And then quick, one more question, if we can squeeze it in. There was a question about life insurance companies. Do you have any recommendations on that?
So we are a nonprofit. We can't recommend, we're not in the business of recommending specific companies. The only thing I would want to caution someone about with life insurance is unlike medical insurance, unlike health insurance in this country, where there are laws that protect people with pre-existing conditions, there are no laws like that with respect to life insurance or disability insurance. So it can be extremely difficult to get life insurance if someone already has a diagnosis.
Good to know. And then what do you do? You may have covered this a little bit. What do you do if your employer-based health insurance may not reach agreement with your care provider at in-network benefits? It sounds like the appeal process generally, right?
I think so. It's hard to tell exactly from the question, but if there's an in-network provider, the pricing of a benefit should be pre-agreed to. It sounds like maybe this is a provider who's not in network and they would like the provider to be in network. I can't quite tell. But yes, if you disagree with the price you're being charged because you think something's a covered benefit and you're not being charged appropriately, that would be an appeal.
Okay, and then what in general is the percentage of treatment costs covered by marketplace health insurance plans and Medicare when I turn 65?
So I'm not sure if what the question is asking is what's the cost share. So the cost share in original Medicare for Part B, for the medical insurance part of it, is 80-20. And on the marketplace, it depends on the plan level. For bronze plans, it's 60-40. For silver, it's 70-30. Gold is 80-20. Platinum's 90-10. But remember that first of all, I'm not sure if that's exactly what the person is asking. But secondly, that's only telling you a cost share. It's not telling you, that's not, the total price as we talked about, right? Because you also have to factor in premiums and you have to factor in deductibles. And for Medicare, you have to factor in the other parts of Medicare. So I'm not sure. That's someone who might want to reach out to us if they have a specific question about a specific cost component.
Okay. Well, we're just at 1 o'clock. I am going to quickly share one more time the sponsors to acknowledge them for their support of this event. I also extend a hearty thank you to Amanda and Triage Cancer generally for giving us your time. I think this was a super helpful event. And for everyone who's still on the phone, if you notice in the chat, there's a link to a post-event survey. And I also will be sending that link out in an email following this. So if you would please give us your feedback, we'd love to know what we can do differently in the future and what topics are of interest for future programs. And unless there's anything else, I'm just going to say thank you and goodbye. Amanda, any final thoughts?
No, just wanted to say thank you so much again for having me, and for everyone else, look out for the resource document that Lindsay will share. And of course, feel free to reach out to Triage Cancer if we can be helpful.
Yes, and Triage Cancer, we will have a link if we don't already on our website as well, in the resources section. And please also note, in addition to the sources for financial support that Amanda mentioned, I also mentioned a couple in the chat, and those are also linked on our website. So lots of options out there for folks who can use some support. So hopefully this was helpful, and we look forward to receiving some feedback from you all. Thank you so much for spending your lunch hour with us. Have a great day. Bye-bye.